Welcome, everyone. I'm Lisa Esquivel-Long, editor of KPC Media's Greater Fort Wayne Business Weekly, and I'll be your moderator for today's webinar. This is the latest in a monthly series that we're bringing free to subscribers. The topic of today's webinar is called An Alternative Solution to Employee Healthcare and is brought to you by the PMG agency. We want to hear what you're concerned about. So during today's webinar, please ask your questions by going to the Q&A section, not the chat, but the Q&A section that you'll find on the right-hand corner of your screen. We'll go over your questions periodically throughout the webinar and presentation today. Here with us today are Scott Pearson, Karen Scherer, and Morgan Pearson. Welcome, everyone. Please tell us a little bit about your agency and what we'll be discussing today. Thanks, Scott.
Hi, good morning. Thank you, Lisa. Well, first of all, thank you, everybody, for attending this morning's webinar. I know everybody has busy schedules, so we're hoping we'll be able to provide you with some informative and helpful information today. So a little bit about our agency. PMG agency has been providing health insurance benefits for individuals, for companies, for group insurance, Medicare, along with other lines of coverage such as dental and disability since 1999. And we're located in Triangle Park here in Fort Wayne. And we do have multiple offices and other locations, and we do provide insurance benefits in multiple states as well. So to my right here is Karen Scherer, and Karen's been working here for PMG agency for, I think, a little over 14 years. And Karen has been very instrumental in developing the Premier One program. And to my left is Morgan Pearson, who is account executive for Premier One and works with a lot of different companies and groups to get initial setups done and just do presentations, et cetera. So we developed Premier One about 5 years ago with the Health Insurance Reform Act that was passed in 2010. It went in place in 2014. We just saw even a lot of our clients that were getting exceedingly high renewals on their health insurance benefits. We saw increases of 40, 50, 60, in some cases, even as much as 70%, and literally within a year. And a lot of it was due to the laws that were passed by the Healthcare Reform Act. It's called the essential mandates, where now companies have to offer such things as maternity, mental health, and just a lot of different things on there. Pediatric dental and vision was included. So no matter what the age, you have to cover this with all your group health insurance benefits. So with that, it also covered pre-existing conditions from day one, and there was no waiting period for anything. So with that, all that put into place, the rates just went extremely high. We also saw extremely high deductibles. I don't know if some of you remember a few years ago where you could potentially get a deductible of maybe $1,500 or as much as $2,000, $2,500, and was still affordable. And now the average deductibles are between $5,000 to as much as $6,500. So a lot of employers were having to deal with that as well with their employees, and just trying to navigate and help get the best benefits possible. So Premier One was developed to help our current groups and our current clients. And basically, it's just an alternate solution for employee health insurance. So I'll be going through the slides here. And like I said, hopefully we'll be able to provide you with some informative information. And feel free to put in questions as we go along. So let's just kind of get started here. So what is Premier One? Premier One is a third-party administrator or TPA program that we developed to assist employees pay for individual marketplace insurance premiums through payroll deduction. So what businesses are a good fit for Premier One? Really, any industry is a good fit. We have doctors' offices and attorney groups and CPAs and factories and a lot of different folks that are with Premier One right now. Also, any business with W-2s, 1099s, or both. So a typical group health insurance plan, you can't offer to 1099 employees. So this gives you a lot more range to offer benefits to different types of employees. And then businesses wanting the option to offer benefits for both full-time and part-time. So on a typical group health insurance plan, you can only offer benefits to those employees that are working 30 hours or more. This allows you to actually offer benefits to employees that maybe only work 20 hours or more. And with the job market right now, it just gives you a little bit more flexibility. So also, Premier One is good for the average employee income of $18,000 or more. If you're less than $18,000, you might qualify for Medicaid, but that's generally the starting point. And businesses that have 50 or fewer full-time employees. And the reason we say 50 or fewer, once you get 50 or more full-time employees, then you have to offer health insurance. It's part of the law. So we find that under 50, you do not have to offer health insurance, but it gives you a lot more flexibility. We do still have companies that do have more than 50 employees that are participating. And we can go through that a lot more in detail if we were to meet in person. So why are employers choosing Premier One? Well, the biggest reason is cost and flexibility. Some of the things we hear is I just received a huge rate increase on my group health insurance and I can no longer afford a group health insurance plans. Or I can't meet participation requirements for a group health plan. Typically for a group health plan, you have to have a minimum of 25% of your employees participating in that program. And with some of the high costs of insurance, some employees are just opting out and going without. Or we hear a lot of my company's too small to offer a group health insurance plan. So this gives you, like I said, the flexibility. And the other one is we have employees in multiple states. So with Premier One, and if you're on a group health insurance plan, typically you have to be in network and you might have an employee that's in a different state and they might not have coverage. So this allows employees coverage in multiple states. And one of the reasons employees really like the Premier One, first of all, they get to choose their own personal health insurance plan that's the best fit for their individual needs. It's not a one plan fits all type of program. And they may qualify for premium tax credits and subsidies and cost sharing, which we'll go over in additional slides. There's no pre-existing conditions. There's no COBRA paperwork. If you have employees over 20, monthly premiums are paid directly to the carrier through Premier One, and so there's no waiting for reimbursements. So let's take a look at Premier One, the individual plans that we have versus typical group health insurance plan. So first of all, as we mentioned with Premier One, there's no minimum contributions. So you could have, for instance, 10 employees and only have 2 or 3 people that might want to participate in insurance because your other employees might have maybe veteran insurance or be covered through a spouse's plan. There's no minimum participation. So, once again, certain percentages of employees can qualify. Then there's no administration hassles with Premier One. Most employers spend less than 5 minutes a month just on the administration. Now, we look at the group health insurance plans there. It does require minimum contributions. So employers must contribute anywhere from 50 to as much as 75% of the premium. They do have to meet the affordability test through the new ACA plans. And it requires minimum participation. Again, you have to have a minimum, in some cases, as much as 50% of your employees participate in the plan. And it does require additional paperwork. You're going through with terminations or additions and once again, COBRA paperwork, et cetera. So it just kind of eliminates a lot of the administration. So let's take a look at a group that was currently with a group health insurance plan. And this is one of our examples of one of our clients that moved to Premier One. So you can see on the top here on the left, they had a group plan that had a $5,500 deductible. And that was the same plan that had to be offered to all employees. At that time, they had 8 out of the 20 employees electing coverage due to the high cost. And at that time, the employee turnover rate was about 37%. So at the bottom chart down here, you'll see the premiums for a single on this group was $450 a month. The employer paid 50% of the premiums. And so the employee portion was $225 or $56.25 a week out of their paycheck. So you can kind of see the example. We even go down here to a family, $1,275 for premium. The employer paid 50% of the employee only premium. So the payroll deduction for this employee was $262 a week. When we moved to the Premier One program, we moved him to a comparable silver plan on the marketplace with a $5,500 deductible, the same deductible. But when we did this, we now have 14 of the 20 employees that were electing coverage due to the affordability. And it moved the employee turnover rate within the first 6 months down to about 18%. So you see on the first one now, the average premium for the employee was now $270 versus $450 on a group plan. The employer kept the same contribution of what they were paying at the $225. So now the employee portion was $45 a month or $11.25 per week. So they went from 56.25 down to 11.25 per week. So just a tremendous difference in just what the overall employees were paying for the same coverage. So let's take a look at the national averages for last year. So the marketplace is in 38 states. The total exchange were a little 14.5 million people enrolled into the marketplace versus when healthcare reform first came out, the average was about 3 to 4 million people. So the number of people receiving a tax credit was almost 13 million, or 89% of the people that enrolled in the marketplace exchange plans qualified for a premium tax credit. So the average monthly tax credit was $509 a month, and the number receiving cost sharing, which is additional help to pay for deductibles, out-of-pocket expenses such as doctor's visits, prescriptions, 7 million people. So almost half of the people that qualified for the tax credit on the marketplace also qualified for cost sharing. Some deductibles we see are as low as $900 to $1,100 with annual maximum out of pockets above $2,000. So that's the national average for this year for the open enrollment. So what's an advanced premium tax credit? It's a tax credit you can take in advance that helps you lower your monthly health insurance premiums on your individual plans. And it's determined and it's estimated by your income. So in the past, you had to fill out medical health questionnaires and you could be rated up or even declined for insurance. Now that we are on the Affordable Care Act, it's deemed and your premiums are based on your annual household income. So what happens if you estimate your income too low? Well, you could potentially have to pay back a portion of that tax credit. So for instance, if you were getting a $200 a month tax credit and you put your income a little bit lower and your actual tax credit should have only been maybe $160, you would have to pay back that additional $40 per month at the end of the year when you did your taxes. But what if you estimated your income was too high? Well, then at that point, you would be able to get money back when you did your tax returns as well for that premium tax credit. And we can go into more detail about that as we move forward. So let's talk about the cost sharing that I mentioned on a couple previous slides. So what is cost sharing? It reduces the out-of-pocket expenses for eligible employees. So basically, how does it work? It assists individuals and families by reducing their out-of-pocket maximums, their deductibles, prescriptions, and even co-pays. And once again, that's based on income as well. So it says who is eligible for a premium cost sharing, and that it would be individuals and families whose household income is 250% or lower of the federal poverty level. So let's talk about out-of-pocket maximums. What is an out-of-pocket maximum? That is the maximum that you would be responsible for out of your own pocket towards your health insurance expenses, which would be medical expenses, prescriptions, your co-pays, deductibles. So for 2022, the maximum out of pocket for a single person is $8,700. And for a family, regardless whether you had 2 or 10 in that family, it would be $17,400, which means potentially, if you had a $200,000 claim and you were a single person, the most you would ever have to pay out of your own pocket in any given year would be $8,700. So for 2023, for next year, that amount is $9,100, and for a family, $18,200. So let's take a look at the federal poverty level chart so you can kind of get an idea of where your qualifications would be. So the Healthcare Reform Act starts at 138% of the federal poverty level, which means basically, as we talked about in the previous slides, the $18,000 is the great starting point for Premier One. So you have employees that are single that start at $17,700 all the way up to over $51,000 a year are still going to qualify for a premium tax credit. You take a look down here, a family of 4 goes all the way up to over $100,000. So that is extremely a lot of tax credit that can be given for families as well. So here's a chart, and this gives you an idea of how that would work. So the first example here is we have a male, 26 years old, with a household income of $24,000. Now this is with cost sharing. So this individual has no deductible on their health insurance plan. Their maximum out of pocket per year would only be $2,900. Now their premium would be $357.97, but they're also going to qualify for $310 a month in that subsidized tax credit, which means their monthly health insurance premiums are $47.97. Now, if we bump up the income to that 45,000, you'll see now the cost sharing goes away, but the deductible is $5,450. Their out-of-pocket maximum is still only $6,450. The premiums, $338. The tax credit is only $68. So their monthly premium is only $270. Compared to basically on a group plan, that same premium would be probably close to $500. Now let's take a look at a 60-year-old male. We did the same household income. You'll see the out-of-pocket maximum is the same. The premium, however, is now $948 for a single 60-year-old male. The tax credit is $870, so that insurance is now only $78.76. We take it down to without the cost sharing, we bumped up the income again to that 45,000. You'll see they still qualify for $627 in a tax credit, and their estimated monthly premium is $270. But I think what's really interesting is you look at the bottom of the slide here as a family of four, and we have the ages here of a household income of $90,000. The individual deductible is $5,400. The maximum out of pocket on this plan is $14,000. But look at the monthly premium, $1,592. But the tax credit is $1,125. So the estimated monthly premium for a family of four making $90,000 is only $467 a month. So what is defined contribution? So defined contribution would be a fixed dollar amount that each employee can use to purchase their own individual health plans through the marketplace provided by their employer. It allows the employer the opportunity to offer different contribution amounts based on particular classes or job titles of their employees. It allows employees to be more involved in their health insurance benefits. It's not the one plan fits all for the whole entire company. So I might want a plan that has a lower deductible because maybe I have a little bit more medical issues or things that I might have coming up, or I might be just an extremely healthy person that only wants a catastrophic plan with a very, very low premium. So it gives them opportunity to pick the plans that's going to be best suited for them. Now, if an employee chooses a plan that costs more than the employer's contribution, the employee would just simply pay the difference through payroll deduction. So let's take a look at how an employer can contribute to individual premiums for their employees. So we do have a dollar amount over here. So you'll see on the top here, it's by type. So employee, in this particular case, management would get $500 to pay for their individual health insurance premiums and assist with that. Maybe a salaried employee might get $300 and an hourly employee might get $150, but you can also increase that based on employee spouse, employee child, or a family. It also gives an employer the opportunity to do by job classifications or job titles. So you'll see here on the bottom, you have a production worker getting $150 a month. The supervisors get $200. And of course, the administration gets $250. But you can also, as we mentioned in earlier slides, offer this to part-time employees. So you could give, for instance, a part-time employee would be making, for instance, $50 or getting $50. The contributions have to be done in a dollar amount versus a percentage due to eliminating the discrimination. So if I was to say I'm going to give each of my employee, I'll pay 75% of their premium. Well, because there's over 32 plans on the marketplace, now an employee can say, well, I'm going to buy the very best plan out there. And if the employer is going to pay 75%, I might choose a plan that runs $1,500, $1,600. So it has to be a dollar amount to eliminate discrimination. So let's talk about an individual coverage HRA. So HRAs were rolled out in 2020, and it allows an employer to reimburse tax-free money to the employees for their qualified medical expenses. And however, though, if you do choose tax-free dollars for the employees, they would lose their tax credits and or subsidies. So they can't, for instance, double dip. They can't get tax-free money from their employee and then, or from the employer, and then as well get tax-free money or the tax subsidies from the government. They won't let you do both. So typically, if you have employees that are averaging $70,000 or more per year that typically would not qualify for the tax credits, as we mentioned before, then that would be a good fit because then they could get tax-free money, and it's called an ICHRA, or an individual coverage HRA. So let's look at optional ancillary benefits that are available with Premier One. So the question we get from a lot of times from employers that are moving to Premier One, what about my dental and vision? Can I still keep that? Yes, you can. We have numerous amount of companies that are on the Premier One plan that still have their group dental, their group vision, accident plans, group life insurance. We can also offer critical illness, cancer plans, short and long-term disability. A lot of cases when we will move a group from a typical group plan, the savings are so great that we're able to come in for the basically what they were paying before and add a lot of additional benefits. So we might have a company that only offers a group health insurance plan. We move to Premier One, the employees get the tax credits, the monthly premiums go down, and allows us extra money to go in and now add dental, vision, life insurance, or maybe an accident plan, et cetera, for the same cost. So now an employer can actually offer 4 or 5 lines of benefit coverage to their employees for the same cost of what they were doing before. Okay, so what's the steps to sign up with Premier One? So basically we would take and have your employees fill out an information sheet. It's basically simple. It's name, address, their zip code and county, and the estimated household income with date of birth. No other personal information is required, no social security numbers, no medical information, et cetera. And we take that information and then we download it and we compare the marketplace plans with Premier One versus your current group health insurance plan, if you're offering group health insurance. And then we do a side-by-side comparison for you to show you which actually would be the best fit for your particular business. And then if the employer decides to move forward with Premier One, then we collect the paperwork, the defined contribution agreement, which we looked at before, the group setup form, and the ACH forms for the monthly withdrawals. And then we do employee meetings to explain the Premier One program. This is a different concept for a lot of employers. So we come in and do personal meetings with your employees. We go through this program with them, explain exactly how it's going to work. And we find it's tremendously receptive to this because of the opportunity to get different plans and things. So then we schedule dates and times with each one of your employees to do their actual enrollments on a one-on-one basis. When we do that, we sit with them. We help them find particular doctors or specialists. We look at in-network hospitals, et cetera. We help them locate prescription benefits that they might be taking to make sure that it's a good fit. So as I kind of mentioned before, PMG agency is a general agency, which means we're contracted with every company out there. So whether it's PHP or Anthem Blue Cross and Blue Shield or United Healthcare or on the individual marketplace, we represent every carrier out there. So we have that unbiased approach that's got to be the best for you as an employer and your employees. And then on the first of the month, we electronically send out our invoices. And that gives you basically 2 weeks to review, to make any changes for terminations, et cetera, for the previous month. So here's a copy of the actual invoice that you receive each month with Premier One. So you'll see on the top portion of it, it is actually a summary, which basically shows you the total premiums of all your employees, the total number of tax credits, which employers really like to see because that's money they're not paying that the employees are getting from the government to help pay for their health insurance. And then it shows the monthly employer contribution. As an employer, this gives you an opportunity to set a fixed cost. There is no more negotiating 15, 20, 30% renewals on your group health insurance plan. And then the credits that you might be issued from the previous month, and then the management fees. And then at the bottom, you'll see we have each employee is accounted for, the employee, and then the carrier they're with. And then we have their ID number, the effective dates. It'll show the total amount of their premium and then the tax credit they receive, and then what their final premium is per employee. And then the employer contribution, whether that be $200 a month or $400 a month, et cetera, per employee is put in there. And then it shows the actual payroll deduction over here, our PMG fee, and then the total amount due. And these invoices are sent out on the 1st of the month, and then the ACH is pulled on the 15th. So let's kind of recap. So it's a solution for small businesses to control the high cost of healthcare, high cost of renewals, the high deductibles. It gives the employers a lot of flexibility that they didn't have before. Kind of more or less, we say, it lets you concentrate on your business or your industry versus spending numerous amount of hours and time on your group health insurance plans or terminations, et cetera, claims, different things like that. So it kind of eliminates that administration hassle you might have. As we mentioned before, employers spend less than 15 minutes a month on these plans, just kind of reviewing. And it increases your employee participation. Now you could have employees, whoops, sorry about that. Now you could have employees that are potentially getting health insurance for maybe $150 a month. So basically the way that would work, for instance, let's say as an employer, you're going to offer your employees $200 a month to buy health insurance. But the health insurance plan that they pick on the marketplace because of the tax credits might only be $120 a month. As an employer, you do not pay the additional $80. You're only paying the $120, which means your employees are now basically getting free insurance from a plan they picked that's going to be the best fit for them. So the individual marketplace plans with tax credit and cost sharing are really tremendously helpful to the employees. And employees can keep the plan even after a resignation or termination. So how would that work? So if an employee terminates, you would notify Karen or Morgan, for instance, and they send out a letter to the employee letting them know their paid to date on their individual health insurance plan and what they need to do to continue that on the marketplace. We also assist in transition to Medicare. As we mentioned before, we work with all Medicare carriers as well for Medicare Advantage plans and Medicare supplement plans. So when we have an employee that would potentially turn to 65 to the Medicare age, it's a one-stop shop for us. We can assist them or any of their family members converting into the Medicare plans as well. So just a quick Q&A that we have from just a lot of times from employers that will ask, can employer contributions be pre-taxed? Well, as we kind of mentioned before, only if there's an ICHRA in place, the individual coverage HRA. As we mentioned before, that's typical for employees that are making $70,000 or more a year. If you would do that, this would forfeit any tax credits. So what happens when an employee picks a plan and let's say the employer offers that $200 a month for that employee, the employee, if they're receiving the tax credits, would have to count that $2,400 at the end of the year on their W-2 as income. And typically we see from a lot of different CPAs or accountants would put that in as what we've heard as like box 14 of the W-2s of their other income. Okay. So what happens if an employee terminates? Once again, they send us a termination form and we send the letter out to that employee, let them know what they need to do if they would like to continue their own individual health insurance plan. And once again, what happens if an employee turns 65 and are Medicare eligible and no longer will qualify for a marketplace plan? We help with the conversion into the Medicare plans. And the invoices are due we send them out on the 1st, the collections on the 15th. All payments are due by ACH setup, so it's very quick. And the premiums are always paid a month in advance. I think this is extremely important to know. So for instance, we would send out the invoices. We did September 1st. We collect the funds for the invoice on the 15th, and we pay the employees individual premiums for them on the marketplace plans by the 20th. And we're paying those for the month of October. So your employees' premiums are always paid a month in advance. So I think that pretty much covers our Premier One program. We would be more than happy to sit down with you on an individual basis or schedule a call and discuss in a lot more detail and how it might be a fit for your particular company. Once again, there's really no industry that would disqualify. So we have a lot of different variations of industries out there. And like I said, we'd be more than happy to sit down with you and answer any questions you might have and go over everything in detail. Here's our contact information. So myself, Karen, and Morgan, you can feel free to call us at any time or send us an email. And again, we'd be more than happy to come out and meet with you in person or have you come into our office or even schedule just a quick call to go through some of the questions you might have or discuss your own particular company in detail. So I think, Lisa, with that, I mean, we think we pretty well covered everything. So we're just open for any questions anybody might have. And just, like I said, help out any way we can. Again, we appreciate everybody just joining on today. We hope the information was informative and gave you kind of a different insight to how you might be able to offer benefits for your employees.
Great. Well, I know we have a couple of questions from Lisa M. So I think part of it you've already answered. She kind of was asking about from the employer perspective, how much they would save. And I think on that graphic for the increased employee participation, you basically showed how the employer could kind of save half of their contribution. And I don't know, do employers come to you and say, this is how much I'm willing to pay? Do you kind of work with them to determine how much their portion will be? Absolutely,
Lisa. That's a great question. And thank you for bringing that up. That is the biggest question we have from employers is, how do I figure out how much I want to give my employees? So typically, if you do offer a current group health insurance plan, you've already kind of got a budget of what you're spending for that, whether you're paying 50% or maybe even 80% of your employees' premiums. So when they give us a budget amount and say, here's what I'm kind of thinking, then we go through and we help them kind of decipher and look at the different contribution amounts they could give to their employees.
Great. And she also wondered about QEHRA.
Those are CUSERAs, and those are a totally different type of plan that are set up for group, and they do have caps on what you can contribute, and there's different tax stipulations that go along with those. And I would be more than happy to schedule a call or set up a call and discuss that in a lot more detail.
Great. And I know everything's so individualized because she was also saying, when selecting a marketplace plan, it's important to consider the doctors and specialists.
Yeah, absolutely. And if I could reiterate a little bit on that, as we've moved on, now the Healthcare Reform Act was passed in 2010 and was implemented in January in 2014. At that time, there was numerous amount of carriers that was on the individual marketplace: PHP, Anthem Blue Cross and Blue Shield, United Healthcare, IU Health. There was just, I think at the time, there might have been 7, 8, maybe as many as 9 carriers. But because of different regulations and different things of that nature, some of the carriers started pulling out of the marketplace. So there was a contingency on the networks. So like, for instance, here in Fort Wayne, on all the network plans, all hospitals are covered. All hospitals are in network. And we were seeing a lot more doctors and specialists that are contracting. At one time, we might only have maybe 1 or 2 pediatrician offices, and now we might see as many as 8 to 10. So as the healthcare reform has evolved, more people are, as you saw in the slides, are joining and going into the marketplace because of the lower cost and because of the tax credits. More of the physicians and hospitals and doctors, for instance, we're basically have to look at those contracting because of losing potential patients. So we don't see a lot of network issues anymore that we did maybe 5 or 6 years ago.
Great. And I know last question I see here from Ian is, have you done any insurance plans for employees who work remotely?
Absolutely. This plan can be implemented for anybody. To give you an example, we do have and represent, I think, Karen, 2, maybe 3 trucking companies.
Yes. Yeah.
And they have truck drivers all over the United States. So we might have a company that is located here in Fort Wayne. The corporate office is here in Fort Wayne, or maybe somewhere really close, but they might have employees in Tennessee or Georgia or Kansas or Missouri, et cetera, that are remote. And we can offer those plans to all those employees.
Great. Well, that's all the questions I see right now. I think people are just in shock at how much maybe they can save. So, they'll be contacting you later. So
yeah, on average right now, we see the average savings typically between 35 to 65%. And that's kind of based on, I know it's kind of a wider range here, but that's a lot of it's based on the deductibles that they currently have, or maybe the plans that they have. But we do see on average that a minimum of 35 to probably 65% savings.
Great. All right, well, great topic today. I hope everyone watching got a great understanding of the different options, that are out there for businesses and dealing with health insurance. But if your question did not get answered today during today's event, PMG agency has graciously agreed to respond to any follow-up email to everyone who registered today. We'll send out the video to everyone who registered, so be on the lookout for that. If you would like to view a previous Business Weekly webinar, submit a topic that you'd like us to cover, find out how you can become one of our presenters, visit us at www.kpceventbuzz.com/webinars. The webinars are free for Business Weekly subscribers. Non-subscribers will pay a small fee. And I want to thank PMG Agency. Anything else that you'd like to mention before we go?
No, I think we covered pretty much everything, just in a broad brush, if you would. But like I said, we're more than happy to answer any questions, or feel free to send us an email at any time to discuss in a lot more detail, or maybe discuss like your personal business that you might have questions on.
Great. Yeah, we know everything's so individualized, and please, mention the webinar that you saw them on the webinar if you contact them. So thanks everyone, and have a great day.
Thank you again.